you can find these amazing speakers on LinkedIn and you can see the amazing work that they've done and you'll know who they are. You're not supposed to know me. Okay, before we get into the hardcore part of the panel, I would like you to talk a bit about what each of you does in your fields or within the digital health space. If you could talk a little about that. Because since we have a very diverse population here sitting in the audience, and not just diversity by race and ethnicity, but diversity by background, by professional backgrounds. We have healthcare, we have people here from healthcare backgrounds, from tech backgrounds, from business backgrounds. So, just keeping all of that in mind, everyone has a very varied experience when it comes to digital health. So just keeping all of those small nuances in mind, if each one of you could just tell a little about what you guys do within the digital health space or within your own professionals. We can start from the left with Dr. Ritu Agarwal.
So rephrase your question. Rephrase your question, Mohammed.
Okay.
You want me to talk about the work that we do?
Yes. Absolutely.
All right. First of all, thank you for the opportunity to be here, and it's lovely to be in an audience of students as opposed to just academic colleagues. I hope I'm not going to have too many teaching moments here, but I might. So just stop me if I start waxing eloquent like a professor. I would like to share something with you that I think is very relevant to you as students. And it's a little bit about how academic careers evolve and how I got to where I am today. As Mohammed mentioned in his opening remarks, I am the founding co-director of the Center for Digital Health and Artificial Intelligence. My academic affiliation is with the business school. So you might ask yourself the question, what are we doing with digital health in a business school? What are we doing with artificial intelligence in a business school? And this goes back to my early days as a graduate student when I was studying artificial intelligence late in the 1980s in a business school, and I was doing computer science as well. And then we went into the long winter of artificial intelligence. I got my first job as a professor, started working as an assistant professor, and very quickly pivoted to looking at the use of information systems and technology to drive value in a variety of different business settings. Right? So I studied financial services, retail, transportation, the airline industry, and I saw the very profound impact that digital technologies were having on all of these sectors. And I started feeling kind of uncomfortable about my own research program, saying, well, why am I using my skills to drive corporate profits? Where can I magnify the impact that any knowledge and skills that I have, where can I magnify that impact? And that's when I had the eureka moment, and this was early in 2000, before health information technology and digital health became trendy. And I pivoted my entire research program to healthcare, and I established the Center for Health Information and Decision Systems at the Smith School of Business at the University of Maryland at College Park, where I was for 20 years before I moved to Hopkins just about a year and a half ago. So fast forward, for the last 25 years, I have been engaged in research, in teaching, in mentorship, in outreach, in working with business organizations and not-for-profit organizations, federal, state, and local agencies, on trying to unpack this very difficult problem, which is how do you take digital health solutions and use them to address what I call the value cost conundrum in healthcare. Right? Now, why am I doing that sitting in a business school? The reason is, I don't believe that digital health solutions will be successful until we adopt a multidisciplinary perspective and a market orientation towards their use and uptake. And when I say a market orientation, I don't necessarily mean a for-profit orientation, but this idea, and in the panel before, we heard about change management, right? We heard about things getting diffused and picked up, or building systems and they never come. Your users never come, your governments never come, nobody ever picks them up, they become shelfware. So the center that I run is a multidisciplinary center. It brings together scientists from computer science, from economics, from operations management, from philosophy, from ethics, I myself am a technologist and a social scientist at the same time, if it's possible to do that. And my center studies, in a very deep scientific way, what are the barriers and facilitators that we have to overcome, both from a socio-technical perspective as well as a market perspective, to make these solutions go to market. So very quickly, for the last 2 decades, the research in the center has essentially tracked the evolution of digital technologies in healthcare. So starting in 2005, we studied electronic health records very extensively. 2010, when the world shifted to mobile technologies, rise of smartphones, rise of digital platforms, we studied ways in which these technologies can be used to improve and enhance patient engagement. And since 2015, our focus has been on artificial intelligence, machine learning. How can we leverage the tsunami of digital data that we have today in healthcare, not just in electronic health records, but just out there in big data on the internet, daily living activities that we can monitor through wearables. So I'll pause there. I don't know if I directly answered your question, but that's how I got to where I am today.
That's a brilliant answer. Thank you so much for that. We can continue with Marla.
Sure. I'm so happy that you came clean about not having a straight public health background, because I have a master's from Hopkins, but it's from the Krieger School of Arts and Sciences.
That's what it's about, diverse applications. We're not looking for people working in public health, we're looking for people working in different aspects of digital health. So you guys are perfect for the job.
For sure. So I have my cheat sheet on the Johns Hopkins Center for Communication Programs, but my background in tech is that I started as a web developer for a public health foundation. So I worked on the domestic side for about 10 years before I landed at Johns Hopkins Center for Communication Programs, where our tagline is, "We believe in the power of communication to save lives by enabling people to adopt healthy behaviors for themselves, their families, and for the communities." So we use a variety of digital tools in our work, everything from interactive voice response and gaming, utilizing influencers and social media for public health campaigns. I'm referring to a campaign for youth and sexual reproductive health for Francophone Africa, producing data visualizations on behavioral data and interpreting that data. So right now we currently have a malaria behavior survey. During COVID, we had covidbehaviors.com, .org rather, which visualized data from more than 36 million Facebook users. Also during COVID, we produced a metadata package for DHIS2. I'm not sure if you've talked about that technology at all yet, to assist those in capturing information on rumors, as well as we host a number of online learning courses around behavior change education for public health professionals, and even a progressive web app that we describe it as Pinterest for family planning. And that's part of our knowledge management work. We're using AI and machine learning for social listening, for publicly available social media accounts, as well as for classification and rumor monitoring. So, my day-to-day is very different depending on the day. I manage the development team in our center. I also manage programmatic staff. CCP is a lot of things. One of the things is never boring. So happy to talk more about that later.
Thank you so much, Marla. We can continue with Arun.
I think you can hear me, right? Okay. First of all, I'm very underqualified to be on this side, so people are gonna think I know the organizing committee, ASAIL, but so my experience is a little more on the practice side. I'm a physician. I work mostly in humanitarian settings with refugees, and I actually got into digital health 7 or 8 years ago because I was interning with a presenter who's coming tomorrow, Subhash Chandra. And when I was interning with him at Harvard's Global Health Delivery Center in Dubai, he made me read everything on digital health. So I was like, okay, now that I have this much knowledge, I should probably use it. So my experience is on how we can use these technologies on humanitarian settings, which obviously brings two separate dimensions of issues. One is the low resource setting that we are kind of used to in global health, but also the momentum of the changing issues, migration and everything. And obviously there is a huge political issue that we don't tend to discuss much on the crises. So what I do right now at Hera, and by the way, I'm not a technologist by any means. I try to learn React Native of watching YouTube videos. Didn't work, so I would not recommend anyone. Just hire great developers. But for me right now, what we're doing is really trying to solve the issues of the end users. So for us, it's refugees, disaster-affected populations. And this usually means not doing the highest tech possible, but rather doing tech that works for them. So for us, a simple thing that I want to mention briefly is, a chatbot, which everyone is doing. It's not cool anymore, I know that. But for us, the trick about it was having the infrastructure so modifiable that we don't need technologists to actually change the prompts or change the tone of the WhatsApp chatbot we're using for refugees. So it can quickly go from being a wise old family member that they like to, talk to a medical advisor once the issue is a more of medical concern. So it's really about how we can modify things to work. Else, shiny new technologies are hardly ever being used in humanitarian settings. I wish they were, but they're not. So that's what I do. Thank you.
That's very interesting because it's very rarely heard of using digital health for humanitarian assistance. So I'm really excited to talk to you a bit more about that. But before that, we can go ahead with Ed.
Hello, everyone. So it's been fascinating to hear the stories of the other panelists about how they've kind of gotten to this point. I came from a kind of a humble beginning. 30 years ago, I was working as a research assistant at the National Institute of Drug Abuse over on the Bayview campus. And I was involved in computer programming, data analysis, statistical programming, and that's when I decided to pursue an MPH here at Hopkins and study epidemiology and biostatistics. As I was thinking about how I kind of arrived in digital health, it was largely because I was a student, and it was really in my second incarnation as a student here at Hopkins in the School of Medicine, where I was a student of health informatics, that an opportunity emerged working with mobile health, and that would have been back in like 2004, so nearly 20 years ago. That opportunity led to other opportunities, and I was eventually teaching and working with students. But the through line was from computer programming and data analysis, there was a kind of a natural transition into informatics. And just to give you a brief and basic definition of informatics, because in my conceptualization of the world, digital health kind of falls under the broader field of health informatics and has a lot to offer if understood. The broad definition of health informatics, as suggested by Dr. Ted Shortliff a number of decades ago, was that it is a discipline that concerns the collection, storage, representation, retrieval, analysis, and ultimate use and application of data and information. And so hopefully you can see that digital health can fall under that broad definition. Well, one of the things that I observed when I started to work in kind of the digital health field and starting to attend conferences, and this would have been 12 or 13 years ago, was that I seemed to notice that those working in the digital health field didn't seem to have the vocabulary of informatics, nor did they have some of the concepts of informatics, which if they would have had, the language around standards, the language around interoperability, not only the language around these concepts, but attempting to apply these concepts. Now, I came into this space kind of with an international bent, my interests were crystallized as I was working for Jhpiego back in the late noughts. But what I saw was digital health, or at the time mHealth, kind of reinventing the wheel or rediscovering that, we need standards. Well, yeah, if you would have talked to an informatician, they would have told you that. Oh, we need systems that are interoperable. Well, yeah, if you would have talked to someone working in informatics, they would have told you that. Oh, we need to design systems with the user at the center of the concept. Oh, yeah, well, you would have known that if you would have listened to what informaticians were having to say. So my view of digital health, my experience of digital health, is that over these past 10, 12 years, slowly the field of digital health has kind of recognized what informatics has to offer and has adopted, and I think has ultimately caught up with. So, and I've been privileged to kind of see that evolution occur. I've been privileged that I was able to teach one of the foundational courses that was first offered here in mobile health and then digital health with Dr. Bill Weiss and Alain Labrique, names that I'm sure are known to many in the audience, as well as listeners from around the world. So that's a little bit about what I was observing. Currently, I work with students, mainly helping students to kind of figure out what they want to do with their professional lives. Some, certainly not all, of the informatics students that I see on a daily basis are wanting to do something that could broadly be described as digital health, or more specifically working in the mobile space, because we can't forget about these things, really. So one of the things that I'm hoping that we'll be able to talk about is some practical advice about how to move from one's student role into, say, that first job, that first internship, or something. As I said, I was very fortunate that when I was a student, some opportunities presented themselves that allowed me to start working with digital technologies and mobile technologies. And I think everyone on this panel and probably all of the faculty want to support and to see students break into the fields that they want to break into. And now,
thank you so much, Ed, for that. I feel like talking listening from experts, digital health experts like you, and talking to many other experts here at the Center for Digital Health as well, I feel like many people got introduced to digital health because of mHealth. So I feel like that's a very common thing I see across the board as well. But we can talk more about that. Let's talk to Dustin first about his role in digital health.
Yeah, I mean, we can just skip me. It's the same thing. No.
Everyone knows Dustin, but I still think everyone should hear about it.
No, thank you. First, I'd like to just acknowledge the organizing committee and all the groups. I mean, I've been here at Hopkins for 15 years, and this is the most ambitious, and I don't mean ambitious in a negative way, but just dedicated group of students that, have got speakers from all over the world, very high-ranking people. And when they first showed me the agenda, I sort of did are you sure you want to, do this? But it's turned out wonderfully this first day, and I, couldn't be more prouder of our students. Second, our class today, I thought we had an outbreak. because about half of our class was missing. But I see the half of the class in the audience today. So not one of them sent me an excused, a note asking for an official excusal, but that's besides the point. Anyways, getting back to sort of my story, I guess started with mHealth. I was initially in a PhD program in neuroscience, doing some lab work, rat experiments, and after a couple of years, just couldn't do it anymore. Wanted the big picture, so dropped out and moved to Ghana for a few months to live with a friend who had always wanted me to visit him. And so there I worked at a pharmacy where I was underqualified, dishing out malarials and antiretrovirals and things like that, and being a total burden on the health system, but I didn't know that at the time. It's a little hindsight. So with that, I sort of got interested in global health, came back. The only thing I was really qualified to do was to be a geneticist, so I worked at UNC for 5 years as a lab coordinator, taking part-time public health classes, and then miraculously got into here at Hopkins in the Department of International Health. And initially came here sort of interested in HIV and AIDS and things like that. I think that one great thing about being a student here is you get exposed to so many brilliant minds and diverse topics. So after a class with Neil Halsey, an infectious disease epidemiologist and vaccinologist, got interested in vaccines, so paired up with the International Vaccine Access Center, and sort of just worked with them for a couple of years, where suddenly this opportunity came up to move to Kenya and be the sort of Hopkins lead on a cluster randomized trial on text message reminders and M-Pesa or mobile money, Venmo, incentives for immunization. So with guidance and mentorship from Alan Labrie, sort of I initially thought he was the whole mobile health thing. I didn't bite it as quick as he did, but sort of, with his mentorship and things, sort of, and him as faculty here giving me, a student at the time, opportunities, sort of just became the mHealth young person moving up, and then a faculty position opened up where now it was looking at trying different advances in survey methodology. So, with COVID, mobile phone surveys, became the rage, but we had been working on mobile phone surveys, since 2015, trying to get better estimates of behavioral risk factors for non-communicable diseases. So that sort of, led me where I am today. I, teach classes. My day-to-day is, much like CCP and others, is different, and it's really driven by deadlines. So if I'm teaching one day, advising students, looking for grants, publishing papers, it's a different day, but it's been really nice now that, sort of COVID's over and students are back to have that interaction with the students. I think that was sort of missing during the COVID times.
Thank you so much, Dustin, and I always love listening to this story because it's so inspirational, and all the students who are here love Dustin and his presence. They really appreciate his presence, so thank you so much, Dustin. So now we have a good foundation of all the speakers that are here on this panel for our audience in person and our audience online. Having this foundation is important because now we can talk a bit about the hardcore stuff, get advice for the students who are here with us today. My first question will be posed to Dr. Ritu and Dr. Dustin because both of them work in, and maybe Aral can chip in as well on this because all three work in very different places but within the digital health space. And just how do you stay up to date with different or use different emerging tools within your own spaces, your own industries? How do you stay up to date with different digital health tools? We can start with Dr. Ritu.
So my microphone has decided to die.
Oh, I am so sorry.
That's okay. I have my voice, so I can speak without a mic. Dustin, would you like to go first? No.
We can hear you.
Oh, okay, okay, yeah, now it's on. Okay, so first, you can call me Dr. Agarwal, so people will confuse me with Smisha. We have the same last name, but we're not related. All right, now, just kidding. No, we're not.
We were talking about this,
Yeah.
but yeah. Please
Yeah,
go
yeah,
ahead,
yeah, yeah.
Dr.
1.4 billion people, many similar last names. Okay, so how do I stay up to date? You know, this is my professional identity. This is my bread and butter. I teach this stuff in the classroom. I absolutely have to stay up to date. I have brilliant graduate students, you know, a couple of whom are in Ed's program, who make sure that their professor knows what's the latest and the greatest. So especially in the field of artificial intelligence, you know, things are happening at such a rapid clip that it's really important to have the antenna out there in the form of your brilliant PhD students who will be continually scouring the literature and keeping you up to date. I also, like all professors and professionals, I attend a lot of academic conferences, I present papers. So, you know, in some sense, that is the currency of our profession, which is, you know, read, and read again, and keep reading.
Yeah, that's absolutely it.
Me? Oh, same thing. I think just to add on it, I have PubMed, automatic searches, and Google Scholar. So I, you know, have a sort of a search terms that every Friday morning I get a, you know, roundup of words that I've put into PubMed. So keeping up the literature that way. And then a lot of it's with the students, particularly around ChatGPT, just like learning how students are using that. Like I have an MSPH advisee, and her capstone is a systematic review, and she's just been telling me how all these students are using ChatGPT. They feed it 7 or 8 articles, ask it to pull out the keywords, and they develop their search term that way. And then, you know, this student in particular is doing her own systematic review and write-up, but having ChatGPT do it on the side, you know, a similar one to see how they're different and what she can pull into that. So I think, you know, the students, I mean, I feel like I'm becoming an old man now, just like where some of the technology and current trends are like bypassing me. But so I think, you know, being around some of the students to see some of the really emerging on the ground trends, and then, you know, relying on literature, conferences, you know, and things like that for the other.
That's great, because that's, you know, what I love about Johns Hopkins, because it's such a symbiotic environment where we get to learn from our professors, but, you know, it's both it works both ways. Alan, would you like to chip in a bit about your about how you stay up to date with digital health tools, etc.?
Yeah, sure. So for us, I think on the you know, doing it daily, like implementing things, require a lot of, you know, the work that we don't want to do, like logistics, talking to donors, grant applications, and everything. And staying up to date can easily be, you know, forgotten. But I think I would say the main point is just being curious, because there is a huge amount of gray literature, or like things that are being implemented that are not written because they sometimes lack the you know, the research capacity. And we do find it often in the field, and we are working with someone who are like, hey, we are doing this. Oh yeah, and where is it? What do you mean, where is it? It's here. We have a website. That's not how we find literature, right? But also my team hates me because I am always the guy that brings like, guys, I found this new cool thing. Let's look at it. And they're like, oh my God, can we just look at the budget first? So, but I would say the main point is being curious and being really excited about the things that we do. So I wouldn't be able to comment more on the research side, because I literally just asked my advisor for a leave of absence of 3 months, so yeah. But yeah.
Perfect, thank you so much. I feel like this answers the question really well. Next question would obviously be for Ed and Marla. What are the different ways in which students here at Johns Hopkins University, and I feel like everyone can chip in about this as well, what are the different ways in which students here at Hopkins, or generally students, can explore digital health as part of their coursework or as a part of their projects? What would your advice be for such students?
Did
You
you?
can go ahead.
Oh, okay.
Thank you. And we have another mic which we can, that handheld mic, which we just keep here.
Oh, this one?
Yeah.
This also works.
So now we have a full number of mics. That's great. Thank you.
Well,
Ed, you can go.
well,
Thank
well,
you.
thank you. Thank you for a kind of a pegged question for me. Uh, As you can imagine, as someone who spends a lot of time advising students, this is something I could spend hours discussing, and sometimes I do when I have a captive student or applicant in front of me. But I have some general advice and maybe and a specific lead that you can think about. But I think it's important for you to kind of understand what it is that you want to be doing in this space. Now, obviously, it's going to take some time to kind of understand what opportunities exist, but I think I have gotten to the point now where I refer to this thing I call the homework assignment that I give to applicants, I give to new students, I give to students who are about to embark on their capstone or practicum or thesis, and to make your efforts as professionally relevant and significant as possible. I think it's important to identify specific opportunities that you want to be pursuing when you are finished being a student. Are there specific jobs that you want to be taking on? So for instance, there might be a job, digital health advisor. Well, if you think you want to be a digital health advisor, go out and find those job descriptions so that you can see exactly what those responsibilities are and perform that gap analysis to look at what your current skills are or competencies are and what the competencies are that are required for that position. So that would be one. Also, if you're... Other opportunities, right? Other opportunities that you might be thinking about or looking at might be PhD programs, fellowships, internships, but being aware of where you want to be going is key and will help to kind of keep you focused on developing the specific types of competencies that are required to get you into that position. I know that this sounds like generic advice, but it probably is worth reconsidering, particularly in these quickly evolving fields and opportunities. I can tell you that if you want to be seriously looking at opportunities working with faculty members, particularly here at Hopkins, you need to recognize that what butters their bread is research. And what they are often looking for in students, if they're going to join the team or the lab, are some practical technical skills. Some of the opportunities that I had when I was young in my career were the fact that I could, program a computer back then with Visual Basic, and I could run statistical software back then with SPSS. Those are antiquated skills at this point. So today we need to be thinking about Python and R and SQL, some of the specific skills that you might want to be ready to have to offer up to faculty and labs if you want to be joining in what they're doing. I think it's important to understand exactly kind of what your conceptualization of all of this is. I've kind of alluded to the fact that, or this concept that we have this kind of more general field of informatics, which is where some of the discipline exists, okay? And then we have digital health or mobile health, which is really where these principles and methods are being applied. So knowing kind of where you kind of fall naturally, are you someone who is applying concepts, or are you someone who is developing new approaches and new technologies and new applications? Some other advice is kind of doing your homework before reaching out to faculty members or even persons with whom you might want to be working in the future, not just for student opportunities, but for jobs in general. You know, it is unproductive. Let me just say that it is unproductive to simply send an email to a faculty member saying, I'm interested in working in your lab.
Yeah.
You will most likely never get a response to that. However, if you demonstrate that you understand what that faculty member is doing, if you have given some thought about how your skills and your competencies fit in with what that faculty member is doing, you have a much better chance of getting a response and engaging and meaningfully participating. Now, as a specific, last week I kind of did some homework, and I reached out to some of my colleagues and I told them I was going to be presenting on this panel, and basically asking them, can I mention your name? And so one person did say, yeah, you can mention what we're doing, and that's Helen Hughes, who is the medical director for the Office of Telemedicine within Johns Hopkins. Now, I would not say to you, go out and send an email to Dr. Hughes this evening. No, I would say, do what I've suggested, which is to do your homework. What is the Office of Telemedicine doing? What is Dr. Hughes doing? What kinds of skills and competencies might be useful for you to offer up if you were to pursue opportunities within the Office of Telemedicine? And I throw out telemedicine as a concept. It's a term we haven't, I don't know how much we've heard the term telemedicine during the conference so far, but it is definitely a related term. And there are definitely some projects in telemedicine that could probably be defined as digital health or mHealth. So, so know your vocabulary, do your homework, and approach faculty member here at Hopkins with a knowledge of what they do and what incentivizes them and how you can contribute.
That was really brilliant advice, because as international students, we don't come here with that experience and knowing how to go about, reaching out to faculty and making connections and making networks. And that's something I also had to learn. So I feel like if someone here is having a tough time with that, I feel like this advice is really good. Not just reaching out to faculty, it's obviously everyone reaches out to faculty, but reaching out with the plan, I feel like that really helped me personally as well. So that's really great advice, Ed. And Marla, you can continue on with that as well.
Yeah. I love that advice, because I wish I had $1 for every time I got an email. I'm interested in digital health. Do you have a capstone? Or like, specifically, what are you interested in?
Yeah.
Not to say that we haven't had students. I've had 2 wonderful students. One that we wanted to hire, and he went somewhere else in Hopkins, much to my dismay. But I love all the advice that you gave about doing your homework and learning and knowing sort of what you want to do and what your space is. And I want to go back to the question before about staying up to date, because I know you're in school and you probably want to be finished with taking classes, but I don't think you're ever really finished with digital health, because like I just took a 6-week class on LLMs, right? Because I wanted to learn how they were put together. And nobody taught me that. No one's going to teach me that. So I seek out those opportunities. So again, like learning Python, learning R, it's really, really important to bring, into research departments. So that would be my advice.
That's great. Thank you so much, guys. That's obviously really great advice. And we'll start moving on towards the end of the session, and then we'll also have Q&A from our audience. One thing that I really wanted to talk about, and I won't pose this to someone specific because I feel like everyone can answer this question. Could you share some examples with some existing projects or topics related to the digital health field within what you're working in currently, and what the students can explore in the coming years? And so basically talk a little bit about your current projects and what the students should be exploring in the coming years. We can start from Dr. Ritu.
How many projects do we have time for?
I'm
kidding.
sure you have
Nah,
so many. I saw
just
your
kidding.
profile.
Okay,
but-
so let me highlight two specific classes of projects, I'll call them, right? One is focused on the patient, you and I, and it has to do with using digital interventions to promote more healthy behaviors in the context of chronic conditions. That's a very generic statement, but more specifically, we are working to integrate data coming from a variety of sources, continuous glucose monitors, various other vitals that are picked up through an app which is called Blue Star. And we are using AI to machine learning specifically to identify a personalized intervention or nudge for every patient. And we have, the system's already built. We're about ready to launch a trial. So we hope to be able to use that as the platform to help people manage not just diabetes, that's the use case, but all kinds of chronic conditions. A second related project is analyzing a large corpus of EHR data to do risk prediction in the transition from pre-diabetes to diabetes. Now, I'm not going to wax eloquent about, the societal and economic impact of diabetes. Everybody knows that. It's not just in the United States, but globally, it's a huge problem. And surprisingly, the literature says very little about, what is Muhammad's likelihood of moving from 5.9 HbA1c to a 6.5 in the next 1 year, right? So wouldn't it be great if you were able to predict that with some level of accuracy? So we have been using, as I said, large electronic health data corpus to be able to do that. Okay, a second class of projects has to do with artificial intelligence and health equity. And here we're doing two kinds of studies. One set of studies is on using artificial intelligence as an agent of good to be able to identify and correct biases in data. And those biases could be due to underrepresentation of certain populations. Those biases could be due to text that is hidden in unstructured data like clinical notes. So we have a number of developments going on using AI as a tool for identifying and correcting biases. And the second is on responsible AI in healthcare, which is how do you design AI systems that can be certified and verified for having an equal effect on all populations, right? Which is both a technical problem, but then it's also a bigger systemic problem because you have to identify the root causes of those disparities before you start plugging the data into the machine learning models. Okay, so
Interesting.
looking for great talent. Anybody wants to, let me put in a pitch. Anybody wants looking for projects in digital health? We're looking for great talent. We have some students from Bloomberg School as well working with the center. So if you're interested, send me an email and I will respond.
And how to send an email, Ed already told you guys how to send an email. So it's a wholesome panel. Yes, please.
I just wanted to follow on, well, not follow on, but comment on something that Ritu mentioned about Blue Star. One of the people who was critical to moving the Blue Star application forward was Melinda Peoples, who was a graduate of the informatics program here at Hopkins, one of the first graduates of the informatics program here at Hopkins. And so, not to overemphasize the point, but some of those core disciplines around understanding how informatics solutions are designed, having evaluation methodologies that are planned, having research that is planned and well executed, having user trials that are executed and well planned. Some of this all starts with the disciplines that health informatics provides us. So keep in mind that if you want to acquire some of the core discipline, some of that coursework may be in the School of Medicine in the informatics department.
Interesting. We can start from Dustin about the current programs because many people love to work with Dustin, many students. I would love to, I would love to know what Dustin works on and what students should be looking to work on in the future.
I might take a different approach and sort of follow up with what Ed said about like what can you offer. And I mean, Samisha, myself, and some others were with the keynote speaker at lunch, and he was talking about what they need, and it's really trying to convince other people within government about the impact of digital health interventions. So be it return on investment, health impact, health outcomes, and so. I think a lot of our projects sort of, we have our primary objective to reach these people or to improve immunization coverage, but I think there's a lot of space that, people taking their econ classes here, could contribute, on an aside to, projects like that. A lot of times costing and things gets left out. So I think that just sort of came to me as one novel approach, to get involved with some existing faculty work, but what a lot of my work is on the Data for Health project through Bloomberg Philanthropies, where we're trying to sort of validate mobile phone surveys across the world in low and middle income countries. So taking this methodology that we use in the US of random digit dialing and, now with mobile phones being ubiquitous, taking that same approach, but having to adjust, for some cultural things and particular considerations. So every couple of years, we get additional funding to run a series of 5 or 6. We sort of call them micro trials, but like, what are the key questions right now? How do we reach old women? How do we ensure it's data is representative? Where does an SMS survey work better than a call center than an IVR? So I've fortunately been able to offer a lot of students data sets to, we sort of are internally analyze the data and get it to the donor right away so that we can inform CDC's larger national implementation. But we have a lot of data sets that I think we have 5 or 6 students working on this year that are just fleshing that out, hopefully not just into a capstone, but to a manuscript and, first authored for the student. So. Yeah.
Interesting. We can start carry forward with Marla about some of the projects that she has and what students should be looking at for the future.
Yeah, similar to Dr. Agarwal, I think what we're looking at, like right now, like this week, moving out is monitoring evaluation, which I heard the panel before us discussing too. We're looking at ways, how we can get access to more data, how we can use that data together so that data, those data skills are really, really important and something that we're in our center looking to build out and find more of. So that's what I would say.
Nice. Arun, would you like to chip in?
Yeah, we actually just, I just sent approval for being a preceptor for the first Johns Hopkins master student who joined our team to help us build this kind of master dashboard that will help us, make data-informed decisions on the ground on where to focus on or which feature to really, our people are using and everything. I can't give too many specific project examples, but what we love to do, and we're always open to having students, researchers, and hopefully some of them do turn into full-time people who stay with us, is really understanding or working together to create evidence on how to innovate in humanitarian disasters or how to, create evidence based on new tools or creating new tools, because it's a very, I mean, the textbook knowledge is disasters are not where you innovate. You do what you've written, you have protocols, which is great, which there's a huge reason for that. But there's also some areas that we can see things are not working great, and then we can really quickly change them. So these are the areas that we love to work with students. We do tend to hope that they come join us on the ground because it is not an, it's not usually what students do. That's not what I did for my practicum in my school, for my MPH as well. But we'd love to do that and working on qualitative data, which I do kind of feel like when we talk about digital health, we usually talk about quantitative data. And with LLMs, now we are thinking more about text, but there's also, I mean, if you think about digital health as being a new kind of, newish kind of area, the core of our research starts with qualitative to understand, you know, what before making causal, drawing the causal pathways. So I think we do need a lot more, you know, qualitative research on it. And it's not just like, hey, are you happy with our product kind of things, but really understanding the pain points that digital health can solve. Yeah.
Perfect. Thank you so much, Arul. Yes, Dr. Diddu.
I just wanted to make one comment on a previous thread on our panel, and that is, you know, what would you want to say if you want to approach a faculty member and want to work with them? So for me, you know, the most compelling email from a student, you know, all of you joined the program in public health because you have a, you know, deep sense of commitment to, I hope, making the world a better place or using your skills and knowledge to make a difference in the lives of lots and lots of people. So for me, the most compelling email from a student is one that says, you know, here's a puzzle, here's a problem, here's an issue with the delivery and the practice and the challenges of global health or whatever it is that strikes your fancy or captures your imagination as an interesting question to study. It may be really half-baked, you know, it may be just in a very formative stage. But if you come to me with a problem, that tells me that you've been thinking deeply about, or at least thinking even shallowly about what is it that you want to be when you grow up. You know, if you just tell me I have Python skills, that's not very interesting to me because I can find Python skills in a lot of places.
That's really interesting. Thank you, Dr. Agarwal. I'm sure Ed has more to add to this question about, he has a wealth of experience behind him about the projects that he currently has and what should students be looking for going forward.
Well, as in my role, I'm not really actively, I don't have an active research portfolio, but I do work with students who are pursuing certain questions. One idea I have is that often what happens with students is that they have a project and say for a master's thesis or a master's capstone, they are able to take it so far, okay? And then inevitably, their write-up includes a statement about future directions.
Yeah.
Well, to me, it seems reasonable that a student might be someone who could help to propel that project forward. What started as a student project, a student area of research, might reasonably be continued as a student area of research. Not always, but for instance, we had a student who finished last year who did a rather extensive kind of landscaping analysis of digital technologies in India. And I thought, well, that was a great start. You know, some of the things that were found were relevant. Could someone who is interested in digital health in India and wanting to do a landscape analysis build on and take that and move it to the next level? Perhaps adding to it, expanding it or narrowing it and making something that is publishable both for themselves and maybe for the prior student. So there may be something to mine with projects that students are doing.
Interesting. Thank you so much, Ed, for that answer. And we'll be moving to the end of the session now, before we open the floor for some questions from the audience. And I usually do this thing at the end when I'm moderating panels, and it's just, I know you've already given advice to students, but if you just going forward, because many are graduating in the next 2 months, many will be graduating next year, for the future ahead, if you could just give them one advice in one line, what would that be? Just in one line. You can't go more than that. And we can just maybe start from Dr. Gibson. Maybe. I know it's a toughie, but you know.
If I break the rules,
I mean, you can. Yeah, you can make a long sentence. Go ahead and make a long sentence, but preferably one, maybe 2 lines. Okay, I'll give you that.
Chance favors the prepared mind.
Okay. Chance favors the. So be prepared. That's basically it. Okay. Ed.
No. I think work hard, work hard, study hard, reach out to people, and eventually something will come to you.
Okay.
There may be a couple, I know this is not one line.
It's fine.
After you leave, you may not have a job for 6 months, but, don't be discouraged. You did your due diligence, hopefully here. And then the other that I heard really nice, like as we're looking for jobs, hello? Is this time too? Hello? No.
It looks like it's
I'm not reading colorblind, so I can't tell. Hello? No. Anyways, in terms of jobs, there's 3 things about jobs. You can get paid well, you can have a good work-life balance, or you could do something meaningful. And if you can find a job where at least 2 of those are filled, that's a pretty good job. So just keep that in mind as you job hunt.
It's working.
Hello? Well, okay.
Okay.
One for the audience.
Absolutely.
Thank you.
So,
Ed.
yeah, I think a certain degree of patience is required. Consider that you've taken 1, 2, or more years in your life to be a student, and the types of positions that you are likely going for are at a fairly high level, and so it's going to take some time. What I will also quickly share about my experience working at Jhpiego is that I interviewed for my very first job at Jhpiego when I was a student. I was not accepted for that job. Right, yeah, incredible, yeah. But a year later, I was contacted by someone, and they had the perfect job for me, and I gladly took that position. So I guess my point here is that even job interviews that you have that may not result in an immediate job can get your foot in the door, and that's valuable.
And that's great advice. Arun?
I'm just going to say consider nonprofits and social impact organizations for your roles, because they're doing amazing things, and it is hard to come by their work in a research setting because most of them are not published.
Interesting.
You
Thank
guys
so much.
took all of mine. Okay. I was going to say public health or digital health jobs are found in multiple places, like you said, in nonprofits and foundations and the government. So there's a wide array of organizations where you can find digital health work. I was also going to say, for my one line, do your research. While everybody says digital health is new, it's also been around for more than 20 years. And there's a problem in digital health where people run in and they're reinventing the wheel. And it's like, we've done that, we've been there. So I would say do your research. And then to Ed's point, I would have to say the best job advice I ever got was to apply to where you're interested to, regardless of whether they have an open position, and that's how I got my first job.
going last, I don't have a lot of unique things to say. What I will add to this conversation, my role has largely been advising people who are going on to look at academia and research as a career. And what I tell my graduate students and what I tell any student is that you got to have that fire in your belly, right? You have to feel the work that you're doing somewhere deep in your gut. And then if that is true, you will be able to communicate it to any employer that you're interviewing with. You'll be able to communicate your passion for what you do to them effectively. And if the first job doesn't work out, then the second will. So that's one piece of advice. And since Mohammed said we could have 2 sentences, my second piece of advice, I'm assuming, one sentence per piece of advice. My second piece of advice is don't be afraid to question your assumptions and rewire your brain, right? So you've taken a degree in public health, you start going out working in public health, and you don't feel a sense of gratification or fulfillment in that job. It's okay to say that, I'm going to start tinkering at the boundaries of my knowledge and the boundaries of my degree and start looking for things that will truly give me a sense of accomplishment, right? I mean, people were asking me all the time, why are you moving after 20 years and a very successful career? And I said, I want to rewire my brain. I want to be in a new environment. And that's always good to keep in mind, even at the beginning of your career.
Thank you so much. These were great advice, and I'm sure everyone here and in the online session really learned a lot from this. I will be opening the floor to any questions. I know we have a few questions from Zoom, but does anyone have any questions here in person? Okay.
Hi,
If
thanks
you could
for.
introduce yourself a
Oh,
bit
yeah, sure.
and then ask a question. Thank you.
I'm Maria. Nice meeting you all. Thanks for sharing your insights. I think my question is to take advantage of the most technologists on the table. Being from outside healthcare as a first background, what kind of skills or soft skills you figure that would be great to learn or to use to leverage your outside mindset? For example, I think technologists learn how to solve problems in a way different way than social science. Is one of the cultural shocks I had coming to MPH, for example. So in working the past years, it's maybe I should learn facilitating meetings, or because then even if I don't have the technical skills they're debating, I can be useful in another way. So if you could share another skill, Ed talk about language or vocabulary, so if you have something else to share in this sense. Thank you.
Would Ed like to go for this, or someone else?
Humans are organic, and they organically organize themselves into groups. And so I think there is no one special, or there's no one answer to your question. But I think as you see and find teams, particularly as you are invited into, if you can get invited into kind of work teams, labs in universities, you will probably see that team does not have the full complement of skills that's required really to kind of move something forward. To Ritu's point, you probably can find a lot of people who can program in Python, but there may be other skills that are not as deeply technical that are nonetheless useful. And without meaning to rely on stereotypes about people who are more technically oriented versus people who are kind of thinking in a different way, I think you're onto something in that. Being able to communicate clearly with a potential user base and eliciting and documenting requirements for a system or a solution is critical. That is not necessarily the skill set that a computer programmer has. It may or may not be something that a computer scientist learns as part of their training. It may or may not be something that a developer does. So there are a range of what we might call non-technical or softer skills that are important. Certainly professionalism, organization, communication, all those kind of general skills are helpful. But I think you were also referring to basically kind of problem analysis, or maybe Ritu was referring to kind of the ability to kind of take a problem, understand it, and understand how technology might be a solution. We used to teach on this stage a course in public health problem solving. Not sure if that's required of the MPH students anymore, but it was 30 years ago. Inevitably, in all of these problem solving analyses, among the possible proposed solutions that were being offered, inevitably it would be more data are required. And so systems for data collection were always kind of part of a kind of a fundamental solution to approach a public health problem. So problem-solving skills, the professionalism, the communication, being able to communicate, the kind of qualitative skills of being able to understand kind of the dimensions of a problem and what humans are needing is really important.
Perfect. Thank you so much. Any other questions?
Can I make one comment?
Of course, of course.
So I would underscore the importance of having skills related to persuasion and negotiation, right? It sort of riffs off what Ed said, but I think the power of persuasion is very, very, very critical to the success of any kind of technology interventions. So, you have to not only convince users about the value of your solution, but you also have to have cogent arguments to support it, right? And that's all part of the power of persuasion. The why, what's in it for me, you have to answer that very compellingly.
Thank you. Rish.
Good afternoon, everyone. Wonderful panel. I had a question, like not specific to anyone, but what role do large language models, which have been around, what role do they have in the enhancement of digital health, especially in low resource settings? Like anything going on to enhance in LMICs, perhaps?
Great question.
I can take that because I brought it up first. So I'd be interested if any of you all are seeing this too. I'm starting to see in a way that people rush to websites or rush to apps. They're rushing to their curated large language models. I don't have a crystal ball. I don't know if that's the future. I don't know if that's a good thing or a bad thing. I know it can be a good thing to control the data that's coming in and making it specific to the audience, which is a problem that we're seeing in low and middle income countries, is that this training data is English, it's US based, it's Christian, it has its biases baked in. So I think it remains to be seen, but I am seeing it.
That's great.
Just to add to that, exactly, that is one of the biggest problems we're having. So the models we're using, we particularly work with refugees, and at the moment we work with Syrian refugees. And just saying that you translate English to Arabic is not enough. And how to adapt it culturally, language-wise, and Arabic, well, it's the same for most of the languages, are not the same. There are different sayings. If you're talking about a medical kind of way people talk, like in Turkish, weird enough, and I heard this when I started working as a doctor, first time was, people would come to you with a headache, and they would say, 2 of my veins got on top of each other, which is not a medical thing, but it's a saying that people use. it's not taught to us in medical textbooks. So if you teach LLM, okay, read all the medical textbook, and that doesn't work. So it's going to be a important thing, because there is the cultural level of, and the training sets are obviously all in English, but there's also the medical level of the end users, not ours as doctors.
Just to kind of keep things real, I remember a story about a midwife practicing in a rural health post, I believe in Uganda. And she was telling the story about how she used her mobile phone in support of obstetric care. She was not typing into some app and getting some response back. She was using her flashlight on her phone to deliver babies when the power was out. So we need to balance, the potential of cutting edge technology with what the realities are still in many low and middle income countries.
And just quickly, I mean, I see it being used as a job aid, task shifter. So for in very rural areas where there's no physicians or very limited qualified providers, we're working with one group, Raxa Health, that it's was trained on Hindi and all local dialects. So language learning not so much of a concern, but can it assist, physicians and trained providers to get to the right diagnosis? I do, the crystal ball, like, we've talked about, autonomous cars and things. I'm still curious, what is the acceptance of this technology, both by the providers that, are relying on them and also humans? I think that'll be like something interesting to follow.
Perfect. Dr. Agarwal, would you like to add?
Yeah, so in my perspective, the power of LLMs in low resource settings is enormous, but so are the risks. So before we, for all the reasons that my colleagues have identified, we have issues related to language representation. We have issues related to, no institutional review boards checking what apps are being developed, all the systemic barriers that you might find in low resource settings. So we need to put appropriate guardrails in place, that's for sure. On the positive side, if you think about all the undocumented knowledge about medical care that exists in so many low-resourced settings, if you think about being able to capture that somehow through these large language models and use it as a way to deliver healthcare that is more customized and tailored to that specific environment instead of relying on Grey's Anatomy or whatever it is for canned solutions to all places. So you might be able to customize it in a more nuanced level, but I think we have still so much to learn about where these models are going. And for me, the worry is that technological development happens at an exponential curve, and our ability to absorb it is not even linear. Sometimes it's just flat. So I don't know at what point we'll have solutions that are not fair, somehow exploiting low resource settings. So we'll wait and see.
Thank you so much for these amazing answers. And just the last question, and I think Arul will be the one answering this. It's directed towards Arul because, and the question is, what advice do you have for clinicians looking to start projects in the digital health space? Not any specific humanitarian space, but just generally in the digital health space, clinicians looking to move towards this space.
Yeah, so the first thing I would say, which was always a struggle with product people or developers, was clinicians. And I'm mostly talking about where I used to practice in Turkey. The patient load is huge and everything. Physicians hate bringing new things to the table because we're barely doing what we are supposed to do. And I saw it with friends practicing here as well. Like, so much of the time is spent on, putting information. And I would argue more than half of it is not for the patient safety, but for the insurance companies. but I'm not practicing here, so you can't, sue me for saying that. For clinicians, I think the value is that there's a common ground that developers, and I don't just mean like software developers, but the product people and providers have to come together. Because one thing that, as an example, when we started Hera back in 2016 or 17, was we were working with developers, and we didn't understand their language, and they didn't understand ours. So it was a huge problem. So for clinicians, I would say work with a great technical person. I see that even in my space, so like, social impact, innovation and everything, the organizations that make it usually have a technical co-founder. I did not, so I suffered through things and YouTube for years. But yeah, I would say work with them, not just to buy things. So you can just go and, get a, developer, hire a company to, make you an app. It's not how things work. It's not how things that last or sustainable are created, I would say.
Perfect. Thank you so much, Aral. And with this, we conclude our session. Before we let you guys go away, I would like to invite Dr. Smisha Agarwal to the stage to give you guys some tokens of appreciation. You guys can keep sitting. I'll invite Dr. Smisha Agarwal. She's been a real support for this 2-day summit and really supported us. So thank you, Dr. Smisha, as well. Firstly, I can hand you the. Firstly, we have Dr. Dustin Gibson, who can come to the stage. Yeah, guys, clap a little. Next up is Dr. Aral Surmeli. Marla Shevitz. Ed Bunker. And Dr. Ritu Agarwal. Thank you so much, everyone, for staying the day, and thank you to our online audience. I know we have a huge online presence, and I hope you guys enjoyed. We have 3 more sessions lined up for tomorrow. Right now, we will be moving on to the networking session at Anna Bacher Hall from 4:30 to